Hey, I'm Dr. Tarun Agarwal, full-time private practice dentist in Raleigh, North Carolina, 10-year NTI user. Love the NTI, great product. I first heard about it from Dr. Jim Boyd at the Townie meeting. In fact, we had him speaking at the first Townie meeting. For those of you that don't know, I'm one of the founders of the Townie meeting, and it's a great meeting, great event, lots of fun. But I was listening to Jim talking about migraines and headaches and masseter muscles and how it's all connected. And it made a lot of sense to me. And everything was great until Jim pulled out the little plastic piece and I had to start relining it myself. And I said, you know what, great product, not the way I want to use it. What I was looking for was a good product that gave great results, but was easy for me to implement in our office. And that's what I loved about the NTI Plus with Keller Labs, is that it's a product that I know is going to work, it's going to fit, and if something doesn't go exactly right, they're going to take care of it for me. And listen, I'm honest, not everything's perfect. 90% of the time it's great, 95% of the time it's great. The few times that it's not great, they take care of it, okay? When we have a problem, they call me and say, your impression stunk. You know, they call my office and say, maybe you should think about a lower NTI versus an upper NTI. Maybe think about an extender. Maybe you should think about a slider. Maybe you should think about these other things for these cases. And what happens is we've learned over time what to do. My team will look at me and say, you know, maybe this is like this patient, and we need to put a slider on this case. So, you know, where we're using the NTI is we diagnose people with migraine treatment, people that have bruxism, clenching. Clenching's the big thing. And then for me, I just tell the patients, this is the products, this is the options. We have little sample NTIs that we show them. And honestly, after that, my team takes care of everything. They're able to simply take an impression, we write up the prescription, we send it, you know, we pack it up in the box, it's pre-labeled, everything's done, FedEx comes and picks it up, and we get it back a couple of weeks later. The delivery appointment is pretty much handled by a team. I walk in, make sure everything's good, and we're good to go. You know, we started with clenching, migraine, started with all those things, and the next thing we added was our cosmetic cases. You know, and as a cosmetic teacher myself, one of the things we teach is you got to protect the teeth, you got to protect the porcelain after you're done. And no matter what anybody tells you, patients are going to continue to clench and grind after the restorative work, so you got to protect it. So we started adding the NTI to all of our cosmetic or reconstruction cases after we're done. And again, it's easy, it's been great. Patients always look at me like this thing's not going to pull my teeth off. And I say, you know what, if your teeth were going to pop off with this thing, they needed to come off anyway. But we've had great success, no patients having any problems, no patients breaking their teeth, popping things off. It's made it a lot easier, and it's a very predictable device for us to use with our patients.